Thank you, Chair. I have no disclosures to report. Let me see. All right, I want to talk to you about a feasibility study that we've done for a new bioreactor that we, for which we used the whole porcine bladders that we got from the local abattoir. Why we did this feasibility study? There's quite a lot of models used for different pathologies in bladder research. And of course, a lot of these are small rodent models. And while a lot of these larger animal models would actually be more representable for the human bladder. So there are some ethical, bureaucratic, and also financial drawbacks in using laboratory animals. And so we try to use these freshly dissected porcine bladders from the abattoir to see if that maybe is an attractive financial, ethical solution for this problem. For our materials and methods, on the right side you can see the model. It's a watertight column that has compartments that can position the kidneys, the ureters, and the bladders in a sort of an anatomical way. For this model, we used 3 months old pigs, mixed genders, which we got from our local abattoir. And we conducted our experiments, of course, as fast as possible, the same day, of course. The column has different entry and exit points that we can use to exit it from the outside. We use an 8 French catheter for that. And we tie down the urethra around the catheter with just simple tie rips. First, we rinse the bladders, and then we assess if the bladders were compliant or non-compliant. And based on that, we divided them in 2 groups. And after that, we did a bladder installation using sodium fluorescein in RPMI culture medium for 1 hour. So for evaluation, we looked at a decrease in the intravesical solution of fluorescein signal. And we used also for immunofluorescence the infiltration of sodium fluorescein into the bladder wall. You have an example on that on your right upper image. Also, we used some urothelial markers, CK18 for umbrella cells, uroplakin-3, tight junctions, and also carnitine sulfate proteoglycans. And the last thing we evaluated was using sodium fluorescein uptake from 1 centimeter diameter punch biopsies, and we used that to quantify our sodium fluorescein uptake using the IVIS optical imaging camera, which actually can be used also for small rodents in vivo experiments. Some examples you can see here. On your right image, the top floor, you can see some of the markers. What was distinguishable is that in the non-compliant bladders, there's a very tremendous increase of sodium fluorescein uptake in the bladder wall. There's hardly any CK18 expression, and also very limited uroplakin-3 expression. For the IVIS measurements, you can see downstairs, you can actually see which ones were the compliant ones and the non-compliant ones. You can see the sodium fluorescein uptake is drastically enhanced in the non-compliant bladder ones. On the top left, there's a normal control. So the results, there was no leakage from the ureters, so that's part that's safe. But we did exclude 3 bladders because of leakage, some due to the slaughtering procedure, and 2 had leakage due to urethral fixation. Like I said, from the non-compliant bladders, there was no clear differences on H&E staining or tight junction expression. The rest I already talked to you about when we were discussing the figures. Apparent, what we didn't expect was that there was an increase in sodium, in carnitine sulfate proteoglycans visible in the non-compliant bladders, while we would expect it in the other ones. We're not sure what the reason behind that is. Maybe there's some more exposure to the proteoglycans due to the the disruptions of these non-compliant bladders that were filled. So in conclusions, this model does need a lot of fine-tuning, but it has the potential to be used for evaluation of bladder permeability on a human scale. And by using abattoir-derived porcine bladders, we could decrease the amount of laboratory animals that we use and reduce cost and administrative burden. In the Netherlands, it's very difficult and very time-consuming to get a laboratory animal investigation started. So this might be a partial solution for that problem. The challenges to be met, to get appropriate control over the quality and the viability of the bred specimens, we need good contact with the local abattoir, good discussion on how to use and how they should be slaughtered. In our case, it's really not a problem. And we also need to improve the transport protocols to get these bladders freshly, as immediately as possible, to our research facility. Thank you.
Thank you very much. Are there any questions or comments from the audience? No question?
Can I just ask, with this larger model, is diffusion a problem if you're putting chemicals into this, either the bath itself or into the bladder?
Based on what we investigated, I think there is a component of diffusion. We looked at the fluorescein, the fluorescein decrease in the intravesical solution. These bladders don't have any vascular system, so I think there's also some fluids from the bladder wall coming into the intravesical solution that's probably responsible for the thinning out of the fluorescein signal. So that is maybe a problem. Also, there's a discussion of what we use in the outer column. We used normal water, which is heated up, and there's liters and liters going into this column. So we might also maybe fine-tune that as well.
Okay.
I have a small methodology question. What do you store the bladders in, and how do you keep them? So you mentioned that you wash them in saline.
Yeah. So we wash intravesically with saline. What we now use for the first pilot is just take them from the abattoir and without putting them on ice, because we think putting them on ice is a problem because it creates muscle rigidity, and that muscle rigidity is actually what's one of the biggest downsides of this whole thing. We need flexible, compliant bladders, and once the muscles are rigid, you cannot do much with them, with these installations. We also made sure that we didn't put too much in the bladder, so just 100 cc's, so that we don't traumatize the bladder too much. But you can also see that the time aspect is really important, what we think. So we need to get these bladders really quickly to our research facility and maybe use crab solutions as a transport medium.
Okay, thank you very much. Any questions? Okay.
I wonder, so when you're doing this perfusion with your the media, do you supply oxygen? I think it's oxygen. You needed to have a very sufficient oxygen, otherwise you may have a problem with keep a good quality of urocellular cells.
Yeah, that is one thing that we are discussing. We might put it into a circulation system that will be feasible with the catheter. Then we use a two-way catheter so that we can actually get some aeration to maybe get some better quality, maintain the quality of the urothelium. We used RPMI as a culture medium to at least provide some nutritional support for the urothelium. So.
Okay, thank you very much.
Thank you.